I started at CTF nearly 3 years ago now. A very long time ago, I got a degree in speech pathology and then did my master's in health administration and ended up managing some case management services, dementia specific services and daycare, and speech pathology department. And then I spent the 12 years of when my children were little working for my husband. And then a couple of years ago, we sold that business. The kids were older, so I was able to go back into a field that I was more interested and experienced in. And this job came up. I'm not ashamed to admit that I had never heard of neurofibromatosis when I read the job ad. But after meeting the CEO at the time and the team, I just knew that it would be a good fit for the type of role that I was looking for. And I love it, and I can see myself being here for a very long time. So the support services team at the Children's Tumour Foundation are constantly writing new resources, and we like to do that on a client-led basis. So if someone asks us a question that we don't have a lot of information on, we'll generate a fact sheet or find some information on that particular topic. So we first started with a health management kit that initially was called a new diagnosis kit, but then people who had been a little bit further down the track of NF wanted one as well, so we changed the name. So this is a kit that is made up, that has a lot of information in it, all these new resources that we've developed over the last 18 months or so. It has checklists on what medical surveillance people need for children and adults, how to talk to kids, a space to keep all your medical information, information for teachers, and information on different things like skin, MEK inhibitors. We've got stuff for teens, information on service providers in your state. So we make these for each person, so we like to have a conversation before we send these out so we know exactly what we're going to include. We have a version for adults as well, and often we'll combine the two of them together if it's for a family that have more than one person with NF. I've just developed this year a parent toolkit for those who have a child starting primary school with NF. And then we're looking to expand on that, and we'll have versions later in the year for older and younger children and for high school students. We do also have some resources for NF2 students at school. So again, people can contact us for information in regards to that. We're more than happy to talk to a school. We can write letters on behalf of parents about their child and how NF is affecting their performance in the classroom, and use that as an education tool for their teachers. We've also just recently developed a very short 3-minute presentation that parents can give to teachers on what are the basics of NF. And the idea is that it's a very brief PowerPoint presentation that the teacher can then go and educate their peers in a staff meeting or a professional development event. So it's raising awareness throughout the school. The support services team really understand just how complicated the NDIS can be to navigate and get your applications approved. So we help families with that process by writing support letters, so we can collate all of the medical information or information you have from all of your different therapists or your equipment needs, collate all of that into one support document. But also behind the scenes, we've been working with the NDIA, so the National Disability Insurance Agency, which came up through our meetings with the Minister, Greg Hunt, a few years ago. And now we have on their website, the NDIS website, information here on what all the domains are and how a person with NF is going to be impacted, and what they could request for each of these domains. So besides writing the letter and having this, we can help people navigate their way through it. If there's review plans, if we've had a few families that have applied 3 times and been rejected, and after we've been involved and done some advocacy, those children now have packages. So it's something we are very proud of here, and it's taking up quite a bit of our time, but it's really valuable work. So here at the Children's Tumour Foundation, the support team worked out that we are able to provide a level of support for people who call us, but it's not the same as if you've got somebody who's had that lived experience. So none of us have children with NF, so we developed a peer leader program where we trained 6 community members. They underwent a training program for 6 weeks, and they are now able to take calls from the community to provide that lived experience, that level of comfort and support and reassurance for community members. We're going to be running a new training program later on in the year, so anybody who's interested in joining that, please contact us.
My name is Sarah. I'm one of the support coordinators here at the Children's Tumour Foundation. I have a background in occupational therapy, and my clinical experience has mostly been working with children and young people in mental health, and young people and their families living with chronic health conditions. It's very important to think about mental health when we're talking about NF. Living with a chronic health condition can cause a lot of stress and anxiety, whether it's receiving a new diagnosis for the first time or even trying to get a diagnosis in the first place. It can be incredibly overwhelming and very stressful for families. There's also the day-to-day stress that living with a chronic health condition can bring. So things such as having to take time off work, time off school, coordinating lots of different medical appointments, meeting lots of new health professionals, and travelling to and from hospitals. There's a lot of things to manage. There are a number of ways the Children's Tumour Foundation works to support the mental health of the NF community. We understand that talking about experiences and connecting with others can have a very positive impact on emotional well-being. Some of the support services that we provide include telephone support and also via email, educational resources and specific NF toolkits, parenting groups such as Tuning Into Teens, which is an emotion coaching support opportunity for parents to engage with. We offer NF Connect Zoom sessions for our young people, adults with NF, and also parents and carers. We run camps specifically for families living with NF, and we also provide peer engagement and support. Another way in which we encourage our NF community to think about their mental health is to consider talking about their mental health with their healthcare providers if they think that's something that's important to them. So here at the Children's Tumour Foundation, we are always looking for opportunities to connect with allied health professionals and build strong networks to support the NF community. We connect with a range of allied health professionals, including nurses, OTs, psychologists, speech pathologists, physios, and social workers. We reach out to healthcare providers and support them with resources and education about NF. And we've also developed a very comprehensive list of state-based health professionals that the NF community members have found to be knowledgeable on NF and helpful in their health journey.
I'm Ruth, and I'm one of 4 support coordinators at Children's Tumour Foundation, and I joined in 2019, and so that's nearly 3 years ago now. It's been an amazing time, and I just love my job. And so what does that mean, being a support coordinator? That means that I'm on the phones, or I'm talking to people online, or we're creating resources. There's so many different things in this role, which I think what makes it interesting. And I think the main thing about our organisation is being the only support organisation working with people with neurofibromatosis. It really gives us that we understand the condition, and there's all sorts of different organisations or healthcare providers that do all different sorts of roles. But I think what really makes us at the Children's Tumour Foundation stand out is our understanding of NF and our understanding of people's different journeys along their path throughout their lives. Like, it affects different people in different ways, but it also affects people differently at different stages of their life. And I think we understand that and are always on the phone talking to people. I love my job because it just brings so much variety into my life. Like, when I come into office in the morning or working from home during the pandemic, I really don't know what's going to happen. There's some days where I might have a plan, but then somebody will ring and that completely changes the course of my day. And it's the privilege of listening to people and their stories, and hopefully walking alongside them during difficult times. That's for me that's a privilege I never even dreamt of having, and this job has just given me so much and brought me to so many incredible people from every age, from 0 to 80. I think I've just, the beauty of humanity and the kindness of people is what I see every day in my job. For me and my job, and my previous role was as a community engagement coordinator. So for me, that's one of the things I love about this job, is bringing people together, and bringing people together who wouldn't have the chance to have been together without the connection to us. And I love that healthcare providers connect people to us. That's also important to me, that people, we'll be dealing, you might have just had a new diagnosis and you're thinking, where do I turn? What do I do now? And my hope is that every healthcare provider says, we know just the people for you to talk to. And quite often we will be the first people that people speak to, and everybody's different in there. You might have seen us online, you might have CTF and done some research yourself and thought, I'm not ready to speak to anybody, and that can also be part of the process. Or you might contact us just once and think, I can't, but I know that we're there. I think for me, being the organisation that people know is there whenever they need us is really important to me. And when they need to connect with other people, or with a professional, or with some information, or I think it's really important people come at their own time and find us and use us in whichever way they want to. So for me, it's all about that personal approach is what's really important. NF Connect is one of the programs or services that we provide. It was born out of the pandemic, which is not a great thing for anyone, but the one good thing I always think that has come out of for us as an organisation was that NF Connect. And what happened, we had 5 camps in 2020. We had 5 camps booked around the country, and we had to cancel every one of them, which was devastating, not only for us, but for everybody who was excited about having those live camps. So we thought, what can we do? So we came up with NF Connect, and it's a simple Zoom meeting once a month with other people. And there's 3 different separate groups. There's NF Connect for teens and young adults, which runs on a Monday night, every second Monday of the month normally. And there is NF Connect for adults, which is for adults with NF. And then there's a separate parents and carers group. And they're all very different in what happens in them, and it's a safe space. So I won't talk about the things that we talk about, but generally I can talk about it's a it can be a space where people connect with each other, and there's been lots of connections outside the group, so people meeting within the group and then realising either that they want to connect online, or that they live around the corner from each other, or that they have a child who's around the same age. So it's created not only the connections with people around the country in that group, it's created connections and friendships outside of that space, which is pretty exciting. So we've got some exciting programs happening this year. We've got Tuning Into Kids, which is a parenting program. It was created by the University of Melbourne, so it's an evidence-based parenting program. And really, it's all about how to better connect with your child and allow the space for the very big emotions that parents and children have. And I think particularly when you're dealing with a condition like NF, it gives you as a parent a space to understand your feelings, but it also gives you some tools and tips on understanding your child's feelings, so that it's not a "this is how you should parent" course. That's what I really love about it. It's here's some tips and ideas that may really help you on your parenting journey. And I know from the last time we ran the course, one of the biggest things was connecting with those parents and sitting in a space, because it's 6 weeks, which is quite intense. It's 2 hours, so it's 12 hours altogether, and that's over a 6-week period. So once a month, once a week for 6 weeks. So it's quite a commitment. But I think the joy of that is then you do really connect with other parents, and as well as hopefully learning and having some fun and understanding yourself and your child and your family's situation a bit better. And Tuning Into Teens is the same as Tuning Into Kids, but it's aged 12 up to 18. So, and that's all about, it can be a scary time being, going through puberty and having your child ask you lots of questions and having emotions that they really might not be understanding. So it's helping you understand those emotions so you can go on that journey together. So you might be thinking, there's CTF, how do I get in touch with them? Well, there's lots of different ways you can get in contact with us. We run a national support line, so the 4 of us are always available to answer the phone and to have, it might be a short conversation, you might be a Ruth, Sarah, Meredith, Natalie, I've got this question, and then you can speak to any of us. We all have we'll have different skills, but we all have the same role, and within that role we perform different services and roles. We play up to our skills. But what you would do, you might just call us on our support line, or you can send us an email at support@ctf.org.au. You might have a query, wondering if somebody could give me a call back, so that we can call you back at a time that suits you, because we know how hard and busy life is. So if you can email us and just say, I'd love a call at this time between 9 to 5, we can facilitate that. We also have our Facebook page, so you can send us a message via Messenger. And you might have been watching our Facebook page for a few years and think, what do they do, and what can I get out of it? Well, I would suggest that you give us a call and we can run through some of the programs with you.
I've been with the Children's Tumour Foundation in one capacity or another for nearly 7 years now. I completed a Master of Genetic Counselling here in Melbourne after having studied back in New Zealand a science and law double degree. I joined the team as my first rollout from the Masters of Genetic Counselling, and really love what I do. Here at the Foundation, we are now supporting NF research in a number of ways. Traditionally, our research engagement has been limited to putting forward funds for projects that clinician researchers have approached us about that align with our vision, mission and goals. That has changed as the global arena for NF research. The Foundation supports NF clinics around the country in a number of ways. Firstly, by providing funding for support and clinic coordinators and clinical nurse specialists, so nurses who look after patient needs within the system. So we provide funding for those roles, which helps to better meet your needs within the hospital system. States and territories that don't have clinics, we have and will continue to work with key decision makers, both within and external to the health system, to ensure where possible that the healthcare needs of our community members are well met. Advocacy is really about promoting the rights and interests of a person or a group of people. Advocacy can take a number of different forms, and you've already heard from other members of the team about how you can get support to advocate for yourself, self-advocacy, how we can advocate with you and on your behalf, which we would consider individual advocacy, but there is also systemic advocacy, and systemic advocacy is a huge part of what we're about as a health promotion and rare disease organisation. Systemic advocacy is really about making changes to the society we live in through advocating for change to legislation, to policies, procedures and societal attitudes.